Oh, hello, welcome everyone. We are here to talk about this book. It's backwards, so I'm going to read it to you. Know Your Endo. This is written by my friend Jessica Murnane. This is a book about women's health, about endometriosis, and I'm excited to talk to you guys about it. We're going to have Jessica joining us. I'm actually going to let her in right now, and we are going to dig into this book that just got released this week. This is a much needed book. I'm just going to tell you guys that right off the bat. I'm excited to talk about it. Hello, hello.
Hi, I am live with the Instagram Live King.
It's great to see you. How are
You
things?
too. It's a very fun week. It's
Yeah.
just like, as you know, releasing a book kind of feels like Christmas. It's like or Hanukkah, you get a lot of love, you get some gifts from friends for all your hard work. It's a very fun week.
Yeah. Nice. Well, I'm glad that you are, enjoying the glow of the book launch.
Yeah.
But this is a book that we should be celebrating because this is a book that I think is very much needed to talk about stuff that, people frankly need to hear. So tell us a little bit before, for the people that don't know you, we have 175 people here right now. Tell us a little bit about yourself and how you basically came to write this book, Know Your Endo.
Yeah, well, I have stage 4 endo, and my life was very different 10 years ago. And through learning tools, through a lot of advocating for myself, learning how to advocate for myself. This is what the book is so much about, is learning how to advocate for yourself, because it takes an average of 8 doctors and 10 years to get diagnosed with endometriosis. And if people don't know what endometriosis is, it's when the type of tissue that lines your uterus grows onto the outside. So, it can cause painful periods, fatigue, GI issues. 90% of people with endo have GI issues. So, when you go down that list, I could check off every single one. And, as I write in the intro of the book, I didn't want to be alive most days because of the pain and the fatigue and just knowing that I would feel that way every day.
When were you diagnosed with endometriosis? Tell us the story about how this all happened.
Yeah, it's so interesting because I think so much people like to talk about their diagnosis journey, if you will, but I wasn't even on a hunt for a diagnosis because I just thought it was normal to be in pain on your periods. So I wasn't diagnosed until I was 28, 29. And that was after I had multiple cyst rupture. I didn't know that they were rupturing. I would just end up at the emergency room and they would send me home after they checked for an appendicitis or they checked for other things. So, it took a long time, but I didn't even know the word endometriosis. So without knowing that word, I wasn't even searching for that as a diagnosis. So it wasn't until I was diagnosed that I even heard that word before. And that's why I appreciate so much me getting to come on and talk to your audience, because maybe some people have never heard of the word either.
Yeah, I'll be curious. Let me know, you guys. Give me a heart if you or someone you know has endometriosis, and give me a wave in the comment box if you don't really know that much about endometriosis, but you're excited to learn about it. Let's see what we get from the people here. So, endometriosis, chronic condition, inflammatory condition.
Very inflammatory.
Makes people miserable.
Yes.
How do you find your way out of it? Where did it start for you?
Well, it didn't start with the diagnosis. I think so much. I think when you work with your patients, you think, okay, well, once you have a diagnosis, then you're on your way. But that's not always the answer. It's learning tools. And for me, it wasn't, it was 10 years after I was diagnosed that I started actually learning to manage it. So this was a very long process for me, and it was a lot of trial and error, but I also didn't have resources back then either. There wasn't books like yours, there wasn't websites, yes, like that. So yeah, it took a long time, and it really wasn't until I was faced with getting a hysterectomy that a friend sort of came in and gave me a resource. She told me about plant-based foods. And, I do like to make it clear that no amount of plant-based foods are going to cure your endo. It's not going to stop your endo. But the point of this book and the point of all of my work is for people with endo to have more good days than bad. Because with endo, that can be a huge win for us.
Yeah, totally. And I think it's important for people to know that this book is not like exclusively, hey, you need to be plant-based and that's
No.
the only path to healing yourself. This book is prioritizing healing,
Yes.
period. So talk to us about some of the things that are in this book, because you do talk about nutrition, but that's like literally kind of just a fraction of the book.
Yeah. Yeah.
There's a lot more.
Yeah, I mean, I think one of the chapters I was most excited to write and the most excited to research was the movement chapter, because I think what so many of us with endometriosis struggle with is getting out of bed, and then we're told you need to exercise to feel better. It's like, I can't even get out of bed. So it's like rude to tell me to go run a marathon.
Yeah.
So in this book, I really explored, this pain avoidance model where when you're in debilitating pain, you avoid moving your body, which then just makes you in more pain. So it's really learning ways that you can move your body that you are capable of that day. So for me now, I wake up and I say, what am I capable of today? That might be foam rolling. That might be a yoga class. It might be running. It's usually not, but that's okay. And, it's learning less of a all or nothing mentality and waking up and saying, what can I do today? And that, to me, the movement chapter was just a game changer for myself researching it.
Yeah.
And then we talk a lot about stress management. And when I say that, similar to the food chapter, I'm not saying you have to be plant-based. I'm also not saying you have to meditate twice a day and go to a retreat. You can do jigsaw puzzles. Like, jigsaw puzzles are a huge stress management tool for me. It's going outside without your phone. Crazy. So this book is truly trying to help you create your own path, because there is not one path for endo.
I love that. And I think it's very important for people to hear that, because many people, what they want is they want you to say, hey, like, this is the exercise that you need to do. This is the magic exercise. And it's like, no. The magic exercise is what you are literally capable of doing today.
Yeah. And I think so much of us, I mean, because of social and because of everything with endo, we oftentimes compare ourselves to people without endo, or compare ourselves to people that, are managing their endo. But what I can do might be very different than what you can do. And I just want to just destroy the idea that there is one endo diet for everyone. But we also know that a lower inflammatory diet can help an inflammatory condition. While there are no studies yet to prove how diet can impact endo, there are studies, at least, that we know that a lower inflammatory diet can help inflammatory conditions. We're getting there on the endo research.
So out of curiosity, the plant-based diet for you personally, I mean, this is just your personal experience. It's not necessarily going to work for every single person in the same way.
Yeah.
But talk to us about the plant-based diet for you. What has that meant for you in terms of managing your endo?
Well, I mean, it meant like 3 months of crying that I had to change my diet. I was very mad about it when it started to work. I mean, I think that's the thing, is I think we see so many people on the other side with, I look at your Instagram with your smoothie bowls and everything. And at the time I was like, I don't want to eat a smoothie bowl. I want to eat the things that I am used to, or the things that I know. But over time, I'm like, wow, this thing is really working. It's lessening my inflammation. It's allowing me to get out of bed again. I'm less depressed. And so you find things that you like. Like, I might not like your brown smoothie bowl, but I like my own smoothie bowl. So I think it's, one of the things I really wanted to make sure that I still could eat was lasagna. Like, I love lasagna. So I figured out how to make one.
You're like Garfield.
Yeah, exactly.
Garfield loves lasagna.
So I figured out how I could eat one. And I'm not talking about, raw lasagna noodles. Like, I'm using noodles and a cashew cheese that, I'm telling you, it stacks up next to the old lasagna I used to eat. So I think it's about finding things that you love, because I think when we think about, at least I thought, changing my diet, I thought I would be eating brown rice and steamed broccoli for the rest of my life.
Yeah. All right. So there's so much that I want to talk about with this book. You
Yeah.
guys know Your Endo by Jessica Murnane. It came out on Tuesday, now available. I'm being completely serious when I say that my patients who have endometriosis, this is the first book that I will tell them to get.
Thank you.
Okay, this to me is what people who have this condition need to hear. And let me just say, and Jessica, you can elaborate on this, that this is a condition that the effect on a person's life is more than just physical.
Oh my gosh, yes, thank you. It's it oh my gosh, it makes me want to cry because it's a full body condition. And when I say full body, I'm talking about the mental health impact. I know you love studies, and the BBC did a study that they interviewed over 13,500 people with endo, and nearly half said they had suicidal thoughts. So we're not talking about, oh, it's just painful periods, like, take some leave. I mean, we're talking about people whose careers have changed, relationships have changed. I mean, there's studies in the book to show how people with endo have had to change careers because of endo. So we need to get these management systems in place. So, it's not necessarily, like I said, like joining CrossFit. Like for someone, it might be going to work. Like that is a huge win for somebody with endo sometimes.
Yeah. How about talk to us about, so I'm seeing a comment. I love all of the supportive comments, by the way, that I'm seeing from everyone. I'm very grateful for these. And if you guys have questions for Jessica, just pop them into the question box because we will do some questions. But I see someone say, a success story is a woman of 43 had third stage endometriosis, and she still managed to get pregnant. Miracles do happen. Talk to us about fertility issues and navigating that with endometriosis.
Yeah, I mean, to be totally real, is probably one of the hardest parts of the book to write because I personally have not struggled with that, but it's so difficult for a lot of people with endo, and 50% of unexplained infertility is because of endo. So a lot of people with endo who never had painful periods, they're not diagnosed with infertility, or they're not diagnosed with endometriosis until they have fertility issues. So I think that, if you're a younger person, I think starting to think about your fertility early as someone with endo can be a really great first step. But yeah, there's a lot of people. I mean, my mom had 4 kids and she had endo. I mean, so I think that there are people with endo that can have children, but it's, I think it's something that if you can start thinking about it early, there's egg freezing. Let's, start thinking about it.
Mm-hmm. Talk to us about endometriosis for the people who are not familiar.
Yeah.
What are the symptoms to look out for? Like, how could you know if you may have endometriosis? Like, who are the people that should be thinking about this?
Well, definitely, I think, painful periods is a hallmark symptom of endo. I think that not everyone with endo has painful periods. So I think, fatigue is a huge one. It's one that is not talked about enough. And the sad thing is so many people with endo don't know that fatigue is a symptom, and they think they're lazy or unmotivated, which is just heartbreaking to hear.
Yeah.
GI issues, like I mentioned, 90% of people with endo present GI issues, urinary issues, frequency, retention. I mean, I used to pee my pants all the time. Like, tell you, it's a huge issue. Painful sex. When I was 21, I went to the doctor and told her I had painful sex, and she said I needed to relax more in bed. I mean, we are going to our doctors and sharing these symptoms, but unfortunately, because they're not connected to a period, a lot of times they're dismissed. And people with endo have been misdiagnosed with STDs, with cancer, with UTIs, with IBS. Like, I mean, it's been misdiagnosed for a very long time. So I think, yeah, go ahead.
When you were 21,
Mm-hmm.
you were having painful sex, you went to your doctor. Were you having painful periods too at that time?
Yeah, absolutely. I mean, yes. Yes.
So point being that although we'll never know with absolute certainty because we can't go back in time, it seems likely that you probably already had the endometriosis as the cause of these issues
Oh my gosh.
at 21, but you didn't get diagnosed till like...
I mean, I had issues from endo when I was 13 years old. I mean, and I think, when you have endometriosis, it's 5 to 7 times more likely that someone in your family has it. So my mom was who I saw as my period role model, and I saw my mom debilitated every month. So I thought that was what happens on your period. So I wasn't even complaining to my doctor as much about the painful periods because I just thought that was normal.
Yeah.
But to be told that you need to relax more in bed, I mean, I think this is where a lot of the mental health impact comes from, is that so many of these symptoms are just dismissed, and it's made for you to believe that it's your fault, that you're fatigued, that you have painful sex, that you need to drink more water because you have urinary issues. Sorry, I get fired up about the part where I just think endo people so much are just made, it's really tough.
Well, I think, tell me if you agree with this. This is me speaking as a physician for a moment. I feel like part of the challenge is that the only way to diagnose endo is to do something that most people don't want to do. And by most people, I mean the surgeons, the OBGYNs. I don't mean the actual patient. The patients would do it if they would get an answer. And that is to do surgery, to do a laparoscopic exploration. And I think because that creates a barrier where the symptoms of endo that people can dismiss and say, oh, it's this or it's that, or you can sweep it under the rug, or you can hope that it's going to go away. I feel like, unfortunately, with these symptoms, it's all too common that doctors are basically like taking that route of saying, it's easier for me to dismiss or sweep this under the rug than to actually put this patient through surgery. So I'm just not going to do that. And I think that's part of the problem.
And I mean, and that's the thing. And I mentioned this multiple times in the book, like I'm not in the business of villainizing doctors. I just think it needs to start from, I mean, the American College of Gynecology still says that a hysterectomy is a treatment for endometriosis. Like, we need to be teaching doctors on a much higher level from the top down about these issues. And, you go to the gynecologist and you get a pamphlet for STDs and breast cancer. Like, where's the pamphlet for a condition that happens to 1 in 10 people with a uterus? Like, I mean, like, there needs to be more education at a patient level. And I think there just needs to be more symptom awareness. I mean, when you're in high school and you take a health ed class about periods, I never heard about endometriosis. My life would have changed if I would have heard about that in high school, not just because of the physical pain, but I wouldn't have felt that I was alone in that.
Yeah. Is it really 10%?
What?
Is it really 10% of women?
1 in 10 women have endo.
With uterus. Wow.
Yeah. And now I also interviewed someone that was diagnosed with endo after a hysterectomy. And just because you remove the uterus doesn't mean that you're removing the endo from the body. It has to be excised properly. And I saw someone comment in here that they had endo on their lungs. I mean, it can grow onto all of your organs. And I interviewed someone for the book that she wasn't diagnosed until she was 53. And at that point, her organs had fused together. So it's so critical that we are advocating for ourselves and asking for ultrasounds and saying, like, no, I am having these debilitating periods. Like, please listen to me.
Mm-hmm. Totally agree. All right. Talk to us about this book and women's health, like, in general. How is this book relevant for people who are just interested in learning more about women's health and perhaps don't actually have endometriosis themselves?
Yeah, I think, I just had a friend call me that just read the book, and she said, I think this is great for anyone that even if they don't have endo, because, really in the book, it talks a lot about advocating for yourself. It's tools that you can use in everyday life to just feel a little bit better in your body, because so much of the time, whether it's endo or PCOS or even some GI issues, a lot of times women's pain and issues are just not taken seriously. And I really hope that this book helps people feel less alone and just say you have every right to advocate for yourself.
Mm-hmm. So walk us through what's in the book. What do we find in there?
So and I saw someone say, what are your credentials? And my credentials are that I went about this book with a journalistic head, and you can see that there's a lot of studies in this book. There's a lot of interviews. There's doctors leading the medical chapter. So I think it's important that when people see this, I'm not prescribing that this is the plan. It's presenting you all of the information, and then you can create your own plan with it. And so it's a 5-week step by step, and I made it a 5-week progressive plan. So week 1, we're really getting to know your endo, and that's connecting your symptoms away from yourself. Because I think with endo, so much like we talked about the fatigue and feeling lazy or unmotivated, we create these symptoms and we think, oh, that's just me. But we need to separate those things. And so that first chapter really helps you kind of separate, these are the symptoms and this is who I am. The second chapter is stress management. We talked about that. I'm not telling you have to meditate twice a day, but I do think that you need to find ways to manage that, because endo in itself is a stressful condition. So if we're not managing that stress on top of the stress of the rest of the world, on top of your kids and whatever, I mean, we're in a bad place. And so the third week is good. I call it the good food chapter, which Dr. B is a huge part of. And good food to me is foods that don't make you feel bad. It's as simple as that. My good foods might be very different than your good foods. And when you find your good foods, that doesn't mean that you're bad if you eat the foods that make you feel bad. You just know what they are. And then the next week is movement, which I told you is my favorite chapter. And then the last week is kinder home and body. And what that chapter explores is what we are putting on and up our vaginas every month when we have our periods, because there are a lot of not so amazing ingredients in the tampons and pads that we're using. It's also exploring what are the lotions and creams that we're putting on our body, because a lot of those can be endocrine disruptors. So we explore that. And then there's a bonus chapter that talks about pelvic floor therapy, Chinese medicine, but I included that separately because I don't think everyone has access to those things depending on their budget or where they live. I'm seeing a lot of endo people in here, and I'm very excited.
Yeah. I love it. That's fantastic. All right. So cool. So talk to us more about understanding the symptoms. Like, what does that mean? Understanding the symptoms. How do we do that?
I mean, I think it's looking at that list. And, I also saw someone in here that said that they've never had painful periods or painful sex. So I think it's looking at that list and just really going through it and just thinking about how am I connecting to that? Do you have worse GI symptoms during your period? Do you have painful poops? Do you have painful urination? I think that we can look at that a little bit deeper. And if you are struggling with infertility issues, I think it's a huge thing to check into. So yeah, I mean, I'm so excited about the big chapter in the beginning of the book that talks about, it's a huge FAQ section with a doctor that's really guiding you through, is pregnancy a treatment for endo? Absolutely not. It talks about hysterectomies, because there is so much misinformation out there. And that's why I'm so excited about this. It's really cutting through the noise and just giving you what you need.
So for people who are curious, who's the doctor? Who's the main doctor that was involved in this project?
Yeah, I have Dr. Carly Goldstein, and she is an endometriosis excision surgeon. She also happens to have stage 4 endometriosis. So it was pretty cool to have a doctor in there that not only excises endo, but understands it herself. She also went through a very long journey through infertility issues. So Dr. Goldstein is amazing. And then I also have huge just activists and advocates in there that have been working in the endo space, trying to change the insurance policies, trying to change from the top down, like I talked about. Shannon Cohn from Endo What, Heather from the Center of Endometriosis. So it's kind of like, the dream team of the Olympics with Michael Jordan and everyone. It's kind of like the dream team of endo in here. It's very good. We're dating ourselves. We're letting people know how old we are. There was a Michael Jordan doc. Everybody knows about the dream team.
Okay, fair enough. You lived in Chicago, so I think you have a certain perspective on that. We have some interesting questions, and you guys, if you have questions, you can drop them into the question box, or you can put them in the comments, and I'll try to do as many as we can here. One of the questions, Jessica, was how do you separate endometriosis symptoms, like what are the things that you would encourage a person to look for to separate something that might be endo versus something that is, say, hormonal imbalance or estrogen dominance or things of that variety?
Yeah, I mean, I think again, it's a little bit tricky because we're not there yet in terms of diagnosis tools. I mean, like you said, like the only real diagnosis tool is a surgery. So I think a really big first step, if you are having a lot of abdominal issues, like if you can get an ultrasound. Now, this will not diagnose your endo, but at least it could give a high suspicion of endo if you have cysts in certain areas of your body. Like for me, when I was finally diagnosed, they did an ultrasound. It's like, oh, we see some, some abnormal cysts and things. And so that led me to get closer to that diagnosis.
Mhm.
So, I mean, gosh, the hardest thing about writing the book is I wanted to wrap it up with a pretty bow and say, here's the answer, but we're still kind of working towards that.
Right. I mean, there's so much that we need to learn. Clearly we know quite a bit about endometriosis, but the solutions, better diagnostic tests, better treatments, getting more surgeons trained in how to treat this properly. I mean, to think that 10% of women have endometriosis, that is shocking to me. I did not know that. I'm a medical doctor. I mean, I'm being totally serious. If you asked me, I would have told you it's probably similar to celiac disease.
No,
which is 1 to 2%.
This is 1 in 10 of, I mean, there could be more. I mean, because it's so misdiagnosed and because the diagnosis time takes so long. Like, think about the generation of our parents and our grandparents. There was no advocacy work for this.
Right.
I mean, so I think what's so cool about this next generation is that they know about periods, they're talking about periods, and it's pretty cool to see. I think that we're going to be able to get that diagnosis time down.
Yeah. Well, I mean, we need to. It's a little bit similar to Crohn's disease, which is something that I take care of, which is also a complex inflammatory disorder. And people that have Crohn's disease, we often discover that they've had it for years and they didn't know. And so I think that there's a lot of parallel things, and we need more research to help us to understand that better. So, so many great questions. Keep them coming, you guys. Let's do a couple more. I am going to save this on my feed. It'll be on my IGTV. You will find it in my stories. This book is Know Your Endo. Grab your copy today. Jessica, someone asked, what treatment, and like treatment could mean, wellness intervention or dietary change or whatever direction you want to go with this. What treatment was a game changer for you?
Well, I mean, food first and foremost was the biggest change for me. I mean, changing to a lower inflammatory diet was the first tool that completely changed my life. I mean, also I used to just eat candy and Diet Coke, so like anything would have helped that. And then I think just movement. And I'm telling you, the movement chapter of this book rocked my world. Like, I didn't realize how powerful it was. And now it's an even bigger part of my life. So, and again, I talk about foam rollers so much, but like foam rolling has helped me so much. Like just putting my butt up against the wall with my legs up. It's just anything I can do to sort of calm my system down, because, with people with endo have higher chances of having depression and anxiety. So anything we can do to just kind of calm our systems down has been a huge change for me. And and surgery. I mean, I am very fortunate that I was able to have an excision surgery. I had a very large cyst removed 3 years ago. But this book is all about things that you can do at home. And we cannot drink green juice till our endo goes away. That's not possible. But what are things that we can do to at least be able to get out of bed some days?
Right. Just being very real and practical about it. And I think one of the things I love is that you describe it not as exercise, you describe it as movement. There are many different forms of movement. And I love the way that you played off of that, which is that it doesn't need to be going to the gym and doing CrossFit, that like literally stretching and just changing the orientation of your body can be what your body is searching for in terms of like making progress. I mean, what do you think?
Yeah. Because we, as someone with endo, so much of the time we're crunched and clenched and hunched and just protecting ourselves. I mean, talk to someone that has endo and there's been a time in their life where they're curled up in a ball on the couch. And so having these movements, I mean, I worked with a pelvic floor therapist. Someone asked about pelvic floor therapy. I worked with a pelvic floor therapist for that movement chapter. And in that chapter, we've included 20 movements that you can do. Most of them you can do in bed. So I
Nice.
think that these are things that I don't want it to be this all or nothing mentality. Like, if the thing that you can do that day is stretching in bed, like that counts.
Yeah, we have some people talking about yoga and how yoga has been beneficial to them. Talk to us for a quick second, just because I love this story so much. I hope you don't mind.
Yeah.
Talk to us for a quick moment about One Part Plant and what that was, because that's your first book, but really One
Yes.
Part Plant really was not a book. It was a book written about something that happened in your life, right?
Yeah, so my background used to be design and marketing and branding, and I worked for a lot of restaurants in Chicago. And when you work for those restaurants, you get paid, but you also get a lot of credit. So I couldn't eat at those restaurants once I changed my diet. And so I created this huge program called One Part Plant, where some of the best restaurants in Chicago started having plant-based meals on their menu. Now there's plant-based meals on most menus, but at the time, this was a big deal to
But
get.
this was like 8 years ago, right?
Yeah. Like, and to get, a plant-based meal on a steakhouse's menu was a huge deal. And
Right.
so that is, actually have that book right here. That's what led to creating the book One Part Plant, which is all
Hold it
plant-based
up.
recipes.
Hold
Okay,
it up for us.
hold on.
Show us real quick. This is
Okay.
One Part Plant. This is it fair to call this your first book?
Oh yeah, this is my first book. Yeah.
Okay, just want to make sure.
Yeah. So that book, and then, but the crazy thing is that I included one page about endometriosis in that book. And the amount of people that said that page helped me get diagnosed at 40 years old, or that page was the first time I ever felt seen. I'm like, why am I writing cookbooks? Like, I need to be writing this book. And I want to gather all of the best doctors and resources that I can and create that book. And there's recipes in that book, but there's not photos like One Part Plant.
How many recipes we got in here?
There's 20 recipes. One Part Plant has 100 recipes. So I think that if you like the recipes in that book, which are all extremely simple, I do not love being in the kitchen for long periods of time. I do not like spending a lot of money at the grocery store. So they're all very easy and quick. And then if you like those recipes, I definitely think One Part Plant is a great expansion to that.
Yeah, so basically this book, this is to me, I mean, tell me if I got this right, Jessica. This is the guide for the person with endometriosis.
Yeah.
This is the book that connects to that person who has endometriosis. It connects with them. It helps them to understand their condition. It helps them to get the right mindset.
Yeah.
And also to properly orient their diet, their lifestyle, their exercise, or their movement. That's what this book is about. One Part Plant is more about the recipes. Is that fair?
Yeah, it's all, I mean, listen, I included endometriosis because I thought if I'm publishing a book with HarperCollins, there's no way I'm not mentioning endometriosis in this.
Right.
Like, I have to, because, it's the whole reason why I was even able to write that book was changing my diet. But yeah, it's beautiful photography and recipes. I feel very proud of both of them, but in very different ways.
Yeah. I think this book needs to be in the hands of every single person with endometriosis.
Thank you.
I'm being totally serious. I really believe that. I think that it will change their life. I think that it will give them hope. They will finish this book and they will feel far more optimistic about how they're going to move past their condition because they read your book, because they read your work. And so you guys know your endo, grab it. It's available through all major booksellers. Do you have a preference on where?
No, I feel like wherever works for you. I'm not going to shame anyone for using a certain
Shame.
A word.
Shame.
You can get a signed book from my local bookstore, Blue Bicycle, but it's available in Canada and Australia and the UK. So all of those options are at knowyourendo.com/book, and just buy it wherever you want.
Perfect. I love it. Any closing thoughts?
I just want to thank you. We met when you were writing Fiber Fueled, and I was like just kind of pitching Know Your Endo, and it just feels like this cool full circle moment that we're here together. So thank you so much for supporting this.
I mean, it's very easy for me to support this. I love you. I love your work. I sincerely believe that this is great. I think that people are going to love it. I think everyone with endo should have this book. I'm being totally serious when I say that. I'm not just saying it. And so it's all just wonderful from my perspective. And I love you, and I think you're great.
Thank you. Love you too.
All right.
Bye, everybody. Thanks for
Bye,
all the
everyone.
endo people here.
Grab this book. Have a good night.